Hi there, and welcome to the Curious Collective podcast, conversations designed for the veteran and first responder community to bring awareness to those holistic practices that help us live our best life. So tap into the wisdom and knowledge of our guests to heal, transform, and live as your true soulful self. Listeners, today with us we have the beautiful Dr. Lauren, who I met through a mutual friend and have had a few conversations with that has definitely taught me a lot about what is happening out there in the healing landscape. So it is an absolute pleasure to have you here today. Lauren, can you please introduce yourself to us and what it is that you're doing in the world right now?
Okay, thank you. Thank you so much for having me on. And I know it's taken a little while for us to organize and get here as two very busy women. And so I'm really excited to be here today. Um, at the moment, my world is very deep into the neuroplastic space. I am working now in the industry of psychedelic medicine and ketamine and how we can leverage these sort of new and novel treatments to help patients who haven't responded to sort of traditional approaches to mental health care. And so I think there's a really nice intersection there with how do you help your brain to be healthier in the long term, which sits really nicely within that holistic wellness space. And so I thought this was actually really a really nice meeting of minds with the Curious Collective.
Yeah, absolutely. And I have found, and this is why it's great to have you on as a guest, that a lot more people are starting to ask the questions. And I'd be curious to see whether
Mm,
you're feeling this as well. And conversations that I'm having, say, in the recovery center that I work in, where people are asking about what is ketamine, esketamine, what does it do, how does it work? Like, and I want to have all the knowledge so I can share it with them, but I just don't. So it's going to be great to have the link to share this conversation. Can you please let us know?
yeah. So I think the first thing to say is that psychedelics, which in the sense that we talk about them today, have been proved in Australia now. I mean, the space is very, very new. It's only been a couple of years that people have actually been treated outside of specific clinical trials. And esketamine sits at sort of the doorway before true psychedelic. So it's termed like an atypical psychedelic.
Mhm.
And that's because some people, about 30% of people with esketamine, will have a traditional sort of magical type experience when they're taking it. And it can be a really good stepping stone into the psychedelic world. A lot of people are still quite reticent, quite concerned about psychedelics, and I think it is a really big mind shift depending on which generation you grew up and your values and
Mm.
bits and pieces to suddenly jump into something that feels quite sometimes quite scary.
Yeah.
And certainly if you've never had sort of a state altering experience, the thought of having a psychedelic trip, I know certainly for people of my parents' generation, that would be something that was very confronting.
Mm, mm. And also, definitely the generational thing, but being in the military, I've been in the military for 25 years. You're told like zero tolerance to
Mm,
drugs, but this, in my mind now, as I see it, and having had lots of conversations and also experienced it personally, is it's not actually a drug. It's a medicine, and it's something that can work with our biology. Are you able to talk into how it actually works with our bodies?
yeah, absolutely. And I'm glad that you brought that up because we see obviously, I suppose the first thing to talk about is where do psychedelics and esketamine fit into someone's health journey?
Mm.
And so obviously they're around there, they're kind of floating around. You're like, when would someone consider using one of these novel treatments? And so in Australia, the psychedelics that we have that are currently legalized, there's two of them. There's psilocybin and there is MDMA and slightly different profiles, but you're right, both of them and ketamine as well have traditionally been illegal
Mm.
recreational style quote unquote drugs. And this is something that really fascinates me from coming from a medical background is that, paracetamol is a drug.
Yeah.
And so it's interesting the perception of when it's been legalized, like MDMA or psilocybin or esketamine, that's all TGA approved kind of stuff now. And now it's moving out of that phase, but it is a slow mindset shift from recreational
Mm.
to medicinal.
It's good to people are starting to have the conversations around it and asking more rather than just putting it into, say, a box.
Yeah, exactly. And so, when should someone start considering potentially a next step treatment? So, about depending on which statistic you read, a quarter of Australians at some point in their life will experience a persistent period of low mood that we would classify as clinical depression. And for a subset of those people, traditional oral antidepressants will help them through that period of time. That tends to be people who have like a really organic cause for their depression, low neurotransmitters in the brain. Take an antidepressant, and that can really help you lift your mood when it's been a sustained period of low mood. But most people, more than half of those people, traditional antidepressants won't work. And it's a really interesting space because if you ask psychiatrists about what is the genesis of depression, what causes it, do we know if antidepressants are going to work for a patient? It is a really poorly understood area, and it is because the brain is arguably the most complex organ in the body. And so our understanding of how the brain works and how psychedelics work and stuff is still, a lot of it's theoretical. And we don't have, exactly, a tiny bit of the iceberg, and so much of it is still underwater. But the research shows that they really do work, and especially for patients who've not had success with other treatments.
Yeah, and I guess on top of that, from feedback from the community, working largely with veterans and first responders, is a lot of people don't actually like the feeling of antidepressants, that sort of numbing or that not feeling themselves is a common comment that I get. Or in my work in somatics is like, you need to feel to heal, and you can't, sometimes it blocks, common antidepressants might block that. Have you heard that as well from a professional point of view?
And definitely not just antidepressants, but not just sort of that numbing feeling with antidepressants, but a host of other side effects. So sexual dysfunction is a big one, as to why people don't continue. Changes to your libido, appetite and weight changes are a big one. People feel hot flushes and all sorts of there's all this stuff that comes with it. Mind you, in saying that, they definitely do work for a small percentage of people. And so if anybody's in that low mood space, I would always recommend the first thing to do is go to speak to your GP or a health professional, because there's a question that sometimes comes up on them. And if you go into the Google search archive, a really common question that people ask is, do I have depression? Yeah, I feel a bit rubbish. It's Monday. I'm not feeling great. Everybody goes through phases where they do or don't have, you have good days and bad days. I would say by and large, most people who are saying to themselves, do I have depression? That's actually not a normal way to wake up on your Monday. And you're thinking, is this something weird? Is something weird going on? That's always the right time to go to talk to your GP. And your GP is going to be able to help you work through that. The other thing that's really important to note is that the funding for these treatments are set up so that if you haven't tried the first line treatment, you will not get funding for the second and third line treatments. And so you do have to go through the whole journey. So if you want to access esketamine or psychedelics, you have to have proved that you've been to your GP, you've tried traditional antidepressants, you've gone through that process, you've made sure that your diagnosis is really depression before you can get on and access these things. And in some ways, that's a bit of a safeguarding, because you don't want people who are not going to sustain a benefit being put on something, or a next step drug like ketamine or psilocybin or MDMA. And so first step is always GP.
Yeah, GP, that's good. And asking lots of questions while you're there, and just remaining really open and curious, and looking for those different pathways with your GP. And I just want to iterate this because I hear it so many times, is if you're not happy or don't feel comfortable with what you hear, go to another one.
Oh, absolutely. And actually, I think it's a sad thing. When I was certainly in my past, I've always had a GP that's been in that traditional family GP type role that I've always felt really supported with. And since then, moving to a big city, and I live in the middle of Sydney, my GP, every time I visit my practice, is a different person. And that is, you don't have that same therapeutic relationship. And so, Kate, just echoing what you're saying. Find yourself a GP that you love and you get on with, because they're going to really help you through all of your medical journey. And there are really lovely ones out there.
Yeah, I agree with that too. Now, I've had a few friends recently talking to me about ketamine being sort of a gateway for them. I know that they had tried the other pathways and just felt that numbing and that heaviness and quite stuck on the merry-go-round and found their way to ketamine. And they have said it has been the gateway to living as well as they do now. And they're doing a lot more things in life, like being able to go out to the shops and being able to interact in group spaces
Yeah.
again and feeling joy and accessing parts of themselves that they hadn't before. Can you explain to us, from your professional background, how does that actually work? Like if someone
Mm.
tries it, like what can happen in the body and brain to bring someone to access these new areas of their life?
Yeah, absolutely. So, traditional tablet antidepressants, they work to increase neurotransmitters in various parts of your brain. And esketamine works well. So, just to clarify, esketamine is the type of ketamine that's TGA approved in Australia, and it's via a nasal spray. So you can certainly still get it into your vein. But the sort of the TGA approved pathway that we're now working on is nasal spray.
Mm-hmm.
And it has two effects. So it has a direct effect on neurotransmitters in your brain. So we call that a direct antidepressant effect. Um, and it's a different pathway to tablet antidepressants. So it means that even if you haven't had success on tablet antidepressants, you can get this real uplift from nasal spray, yes, ketamine. Um, but it has a second benefit as well, which is the really exciting new benefit of these psychedelic and atypical psychedelic drugs, which is increases neuroplasticity in the brain. And neuroplasticity is just a fancy word for your brain tends to use the same set of neural pathway routes to go around. And neuroplasticity is just your brain being able and being a fertile ground to create new connections. Um, and change old ones that have potentially been there for a really long time.
So that continuing spiraling thought patterns and things like that, perhaps like, oh, I should try this, or what if I do this? Like maybe sparking curiosity.
Exactly.
Mm.
And I like to use a bit of a synergy, which is like when someone's been overweight for a long period of their life, losing weight is incredibly difficult from loads of societal genetic reasons and all sorts of bits and pieces. Very, very difficult.
Mm.
Unless you have the benefit of a GLP-1. You've got to have something that comes in there and really changes the way you've always done things. And
Mm.
that's kind of can be similar to how neuroplastic agents work, is that once you've had a habit is so strong in humans. And so
Yeah.
if you want to start thinking a different way and living your life a different way, having a neuroplastic agent that supports that
Mm.
makes your life a little bit easier when you're making those changes.
Mm. And it might also be like I'm hearing like the word integration is having a supportive person in your life or someone that's living how you kind of want to,
Mm.
accessing more joy or going to public places or, putting themselves first. To have alongside you, your environment always makes a difference whilst you're
Mhm.
taking these ketamine treatments so that you can start to see this within your own life.
Oh, absolutely. And so when people are accessing, esketamine treatment, the best thing that they can do is engage in psychotherapy or, as you say,
Mm.
have a support person that's encouraging them into new spaces because esketamine doesn't do the work. It allows you to do the work. And
Mm.
so it allows you to start, as you say, we see people who have been so unwell for such a long time that, they haven't been able to get out of bed kind of stuff. And so
Yeah.
it allows you to get out of bed so then you can do everything else, which is evidence proven to improve your mood. So if you think about the best thing that anybody can do for their mood, it's exercise. And if that's walking to the shops, working to the post box, walking to a friend's house, that is often just impossible for people who are suffering with depression.
Yeah.
Um, and so, as you say, it's getting out, it's the ability to do all the other things that are going to help your mood even more than any drug will ever do. And so that's kind of where we see people in their journey is we provide them with kind of a platform to go and engage with everything that's gonna make them better long term.
Oh, I love that. And I love so much that you said, you spoke into that it isn't actually the ketamine that does the work. It creates the space for you to,
Mm,
because I have seen a lot of it is like that external seeking of, I'm looking for that thing that's going to fix me. It's like, there isn't just
yeah,
one thing.
yeah. But also, I mean, the saddest thing is that most people, by the time they find a next step treatment like esketamine or like psychedelics,
Mm.
these people have been mostly, I mean, the average rate of moving to a next step treatment is 20 years with a diagnosis of depression.
Oh,
And
wow.
so that's 2 decades of your life you've lost. You've not been able to live fully. And that's really what breaks my heart is that these are people that we could have given, if we'd seen them earlier, could have given them a decade back in their
Mm.
lives. And so, but the longer that you leave depression, the longer it creates those grooves, those thought patterns in your mind that are quite really, really negative. The same as with that PTSD, chronic negative thinking. The
Mm.
longer you leave it, the deeper those grooves form. And so then the longer it takes to treat. And I think there is this idea, this silver bullet idea that I've been chronically depressed for 20 years, but I'm going to be fixed in a week. And
Yeah.
unfortunately, nothing in life is that simple, is it?
Yeah, yeah.
Yeah.
And I think over time, like myself and a lot of the people I work with, you actually find joy in doing the work, or,
Oh,
once
totally.
the light is shone in there, say from the esketamine or whatever treatment it is that you're investigating for yourself, you actually start to enjoy doing the things that cause you a little bit of discomfort. I most certainly do because I'm like, oh, it's working.
Yeah. Oh, it's the most satisfying thing. And also, we see people obviously who, I mean, a mixture of people, but often it's the partner or the family that is saying, they're the first ones that see the change.
Mm.
Even if sometimes, you see someone who's really struggling and they say, I'm not sure it's working. But then you speak to their partner, and the partner's like, he or she woke up this morning and got out of bed and made breakfast and had breakfast with me. And it's
Mm.
like that's the kind of story that I think is really, really, that's the stuff that gets us out of bed in the morning.
Yeah, absolutely. How good. I think it's a brilliant that this is accessible and out there for people. And if people are curious and they're like, well, I just don't know anything about it, what recommendations would you have for people to perhaps do more research or reach out? Like what's out there for those that are asking?
Yeah, great question. So unfortunately, with medical practitioners as a whole, it's a group that's incredibly overworked and overstressed and
Mm.
overburdened. And so, um, to incorporate this into general medical practice is going to take a lot of time for people
Yeah.
to start recognizing when you go to your GP, it's very possible that your GP won't know about next step treatments for mental health. And it's
Mm.
not your GP's fault. They're working really hard and you're doing
Yeah.
all this stuff. And so what I would say is really empower yourself to go online. Like if you type in esketamine or ketamine therapy or neuroplasticity or psychedelic research, especially with your new AI summary at the top, that
Mm.
is going to give you a really good overview of all of the research so that you can
Mm.
make all of your decisions in a way that's super informed. And if
Yeah.
you go in and you have that power of that knowledge and you've read the research, then you're going to be making the right decisions for yourself.
Mm.
And you don't have to be a doctor or have had a scientific background because, as I said, that sort of the new AI summary at the top is
Yeah.
going to give you quite a good overview. There's lots of good resources out there that will tell you what you can realistically expect in terms of benefits, but also a really honest view of side effects and bits and pieces.
Mm.
Um, and then if it turns out to be something that you might be interested in, there's now luckily loads and loads of clinics and providers across Australia.
Yeah.
And so the treatment is very similar at all of them. The
Mhm.
only thing that I would say about people exploring this is just remember that it should be done with all of the other good stuff.
Mm.
Because
Mm.
depending where you go, they'll give you the treatment and then you won't have that sort of holistic support and care. And
Mm.
so make sure you're connecting with, your rest of your curious collective
Yeah,
friends to,
yeah. And I really wanted to speak into that as well as like that peer-led support. Like I know a lot of people in the Curious Collective community that have tried esketamine, even
Mm,
psilocybin, even a lot of these different
mm,
therapies, is if you're wanting someone within the veteran first responder community to talk to, please reach out and ask me, and I will connect you both with permission from both sides, of course. But also, yeah, holistic frameworks around the medicine is so supportive, even with breath work, right? Because I'm a breath work
mm.
practitioner, is you can reach altered states of consciousness in a breathwork session. If I was to just do breathwork with you and then you leave, and then I don't follow up, and you're just out there going, what just happened? Like, I don't understand it. Like, it's the same as exploring with these new medicines, or they're not new, but now approved medicines. What are your thoughts on that, Lauren?
Oh, Kate, I couldn't agree with you more. And I think it's important to contextualize neuroplasticity and altered states within this kind of stuff that we experience in the day to day, because the best agent for neuroplasticity, yes, psychedelics, MDMA, ketamine all do that for you, but they're all mediated through a particular scheme of enzymes and changes in your brain when your brain is sort of thinking, oh, look, this is a good time to change. There's fertile ground. I'm stimulated. I'm excited.
Mm.
Brilliant things that you do not have to go to your GP to get neuroplastic changes include exercise. Yeah, if you go out and exercise, your brain is primed for neuroplasticity, learning a new skill. And like you said, I love that you mentioned mindfulness and breath work gets you to altered state. You may not need a psychedelic. Mind you, in saying that, generally, the population that we see for these next step treatments,
Yeah.
they don't have the ability to do that by themselves.
Yeah, they
And that's
can't
partly
access it
just
yet.
exactly.
Mm.
And I suppose as a breathwork and a mindfulness practitioner, there's hard graft to goes into. Like mindfulness is hard work and it's
Yeah.
a long journey. And so what I would say is don't be discouraged if that's not something
Yeah.
you can do. If you can't exercise, if you can't do mindfulness, there will be other options that get you to that stage. Sometimes people need help to the starting line.
Absolutely. I love that. And there's so many beautiful resources out there. I know I've read a book, How the Brain Changes Itself, that's on
Mm.
neuroplasticity. There's one I'm reading at the moment. I don't know the name of it, but the analogy that they're using within it aligns perfectly with everything you've shared. It's actually seeds. So, like planting seeds. S is social connection. Education is one of them. So, the learning new things, exercise, which you spoke into, diet, and sleep. So I think that analogy is just beautiful. And I say all the time, people ask me, what have you been up to? And I'm like, planting seeds.
Oh, it's so good. It's so good because you also like we have managed to derive, all this stuff medically, which is wonderful. But you're right. The best thing are those five things, and they will do more if you look at the studies that compare medical intervention to, that holistic. I'm sleeping, I'm making connections, I'm
Mm,
eating well, I'm taking myself out, I'm seeing sunshine, I'm touching grass, that kind of stuff will always do better. It's harder to sustain those habitual changes. And that is hard, hard work to say to someone who, can't get out of bed in the morning, all you have to do is all these five things.
yeah, they really want to be able to do those things, but they're
Oh,
just not accessible. I totally get it.
exactly.
Yeah.
And then the other thing that I wanted to mention as well is around PTSD in the specific community, sort of that you and I sort of interact with on a regular basis, the veteran community and the first responder community. And a lot of that, I mean, I think PTSD is another space that's poorly understood for the same reasons. The
Yeah.
brain is quite confusing. Um, uh, is PTSD more often than not coexists with depression.
Hmm.
Um, uh, but PTSD has that typical phenotype of that chronic negative thoughts and the ruminations
Hmm.
and the flashbacks and bits and pieces. And so read
Mm.
the research about what can psychedelics potentially do for you, because
Yeah.
MDMA, esketamine, psilocybin, all a little bit different on that front. And also the other thing is that these drugs have not been around for a long time. And so, especially in the psychedelic space, a
Mm.
lot of the early research has been really, really positive, but there's more work to be done. And
Mm.
so I'm always cautious whenever I speak to someone about psychedelics is what we know is good, but we don't know everything. And anybody who
Yeah.
tells you they know exactly how these things work and what results it's going to deliver to you as an individual,
Mm.
I wouldn't necessarily be trusting those people because it
Yeah.
is still a work in progress.
And every single person's experience will be completely different. And even say from one treatment to another, you can go in once and have this like experience, and then perhaps the next time you're like, well, nothing happened today. Like, and that's
Yeah.
okay. Like, that's just how that was that
Yeah.
day. Like, it going in with too many front-loaded expectations is possibly not a good thing either.
Yeah, absolutely. And I think I love the idea of the as long as you're trying something,
Mm.
That's brilliant.
Moving in the forward direction.
Exactly, exactly. It doesn't matter with what, but move in the forward direction. And I think our mission a little bit is to demystify what that looks like for people.
Yeah, I
I
love
think it
that.
can feel a bit overwhelming to be like, I'm depressed. Somebody is telling me to do this. Someone else is telling me to do that. I don't know where I'm going. Am I supposed to have TMS? Am I
Mm.
supposed to have ECT? Am I supposed to do, and it all just is very confusing. But actually, from the other side of things, when you have the knowledge, the puzzle pieces fit together quite nicely. It's not that confusing. And so if you speak to somebody who's got a bit of experience in the space, and they might give you three options, but there's probably closer to three than 30. And so
Yeah.
sometimes feeling a bit overwhelmed by thinking, oh my God, there's so much information out there. There's not that many next steps. And so speak to someone and help, that'll at least make the next stepping stone clearer across the river. Because you don't need to
Mm.
see the 10th one. You just got to keep moving and I don't know. So yeah.
Such good advice. Thank you for that. Now let's close up by I want to ask you personally a question. Why is it that you work in this space and why are you so passionate about it?
Mm. So obviously I trained originally as a doctor and I trained in New Zealand and um I come from a family of doctors. I wanted to be a doctor so bad and I wanted to be a psychiatrist. And when I started working in psychiatry, I saw the best intentioned people being a little bit constrained by the system.
Mm.
And our healthcare system is amazing, and the people who work within it, by and large, they're trying their hardest and they're doing their best.
Yeah.
And when you have the system, which is kind of in some ways an easy thing to fix, dampening the efforts of really good humans. I think
Mm.
that's the first thing is that I've moved out, I left that, and then I moved into healthcare management to kind of try and be like, well, can we design the system so that individuals can actually do the best that they can? So there's a lot of
Mm.
system issues. And the second thing is that I had terrible depression as a teenager. And I'm like in one of the few people who actually respond to traditional antidepressants, and my depression is by and large well treated on a day-to-day basis.
Mm.
But I remember that feeling of loneliness and being scared and being lost and standing in the middle of the river and being like, where is the next stepping stone?
Yeah.
And knowing that there's next step treatments and there's people who live with depression and no one's told them that there is somewhere else you can go,
Mm.
that breaks my heart. And so if I can do a little bit more, if I can treat one patient one day earlier and give them one day of their life back, that to me is a good day.
Oh, that is so beautiful. And thank you. Thank you for doing the work that you do and educating and just being that voice that people can know that there are the other steps out there. And thank you for coming on the podcast today because I think this will be great link to share personally. I'll be sharing it. But if you're a listener tuning in and you've heard something that could perhaps help someone else, please do share this conversation along. Is there any other things that you'd like to share with our listeners before we part ways, Dr. Laura?
Um, no, Kate, thank you so much for having me. It's been lovely to have a conversation. And I just want to echo that, if you're in a dark place, there is always a listening ear out there. It may not feel like it, but, there's people like Kate, people like myself who will chat. If nothing else, reach out to someone for a conversation.
Absolutely. Thank you so much, Dr. Lauren. Thank you, listeners. Katie out.